The nation's two largest pharmacy chains, CVS and Walgreens, announced Wednesday they are settling lawsuits over their roles in the opioid crisis. The companies agreed to pay about $5 billion each. The lawsuits accuse the chains of filling opioid prescriptions that should have been flagged as inappropriate. If the deals are closed, it would bring the total value of all opioid settlements across the nation to more than $50 billion. Now it's up to a group of state attorneys general to sign on to the settlement. Peter Mougey joins me now. He is a shareholder and the chair of the Securities and Business Litigation Department at the law firm of Levin Papantonio Rafferty. Peter represented some of the communities in these settlements. Peter, welcome. Thank you very much for joining us. Where will the $10 billion go?
The $10 billion is going to go directly back into the states and the communities that are responsible for first responders that show up at the scene of overdoses, treatment, education. It's going to be put to much needed use to curb this epidemic and bring an end to the overdoses.
Yeah, more than 250,000 overdose deaths have been directly blamed on prescription opioids over the past 2 decades. Will the families of the deceased see any of this?
The families of the deceased will not see this. This money and the lawsuits were brought by the state attorney generals and local communities. And obviously the heartbreaking victims across the country have brought individual suits, but this settlement will go to curbing the epidemic through education and treatment and quite frankly, just making sure that this cycle of addiction stops and that the pills in our streets that were supposed to be cut off by the pharmacies through the red flag systems and weren't, that spigot of pills and opiates into our communities is turned off, other than those people that need the medicine, and hopefully put a stop to the overdoses and the deaths.
So in a statement, CBS said, quote, "We are committed to working with states, municipalities, and tribes, and will continue our own important initiatives to help reduce the illegitimate use of prescription opioids." Walgreens said something similar. Neither company admitted culpability in these settlements. Peter, how does that sit with you?
Well, there's 10 billion reasons of what these companies have admitted to. This has been a 5-year slugfest of litigation. I'm very pleased that this money will get back into our communities and we can transition to healing and transitioning to getting money into curbing the epidemic. Now, you know, the statements that we don't admit or deny any liability, I think you don't have to count any more than the $10 billion to figure out where the proof is in the evidence that was submitted in this litigation around the country.
So Walmart is also in talks for a major settlement, and Purdue Pharma, which created OxyContin, proposed a $6 billion cash settlement. What do you expect to see out of those?
I think that, timeline-wise, I think that money is going to start flowing. What's great about this is we have the big 3 distributors and J&J, that the settlements were finalized last year. That money is getting into our communities literally day by day by day this year. These 3 pharmacy settlements, the first 2 with Walgreens and CVS, I think the money will begin flowing mid to late year next year. And I'm hoping that Purdue and Mallinckrodt in the bankruptcies will start to hit about the same time next year. So I think by the time we hit next year, the infrastructure will be created on treatment and education, and we'll start seeing a significant and material decline in the number of pills, and as a result, the overdoses and the deaths.
Bottom line, Peter, what is the message and the statement that you hope is sent, particularly to the pharmaceutical companies?
The message to me is that this is self-regulation. They have a huge upside with profits. They've made a tremendous amount of money, but along with that comes responsibility. So the upside with the profits comes responsibility of self-regulation. And it's disheartening to me that it's up to lawyers, whether it be state attorney generals, whether it be local government lawyers, the executive committee of about 20 law firms that brought these suits around the country to hold these pharmacies accountable. It shouldn't be lawyers that have to file these lawsuits to get us where we are. And I'm glad that we can transition to healing. I'm extremely excited that we can make change in our communities. But this shouldn't be the way our system works, that we have to force companies to self-regulate and follow the laws in the space that they're in. And it doesn't matter what space. It's securities, it's the food distributors, it's pharmaceuticals, which are inherently dangerous. We shouldn't have to count on lawsuits for companies to govern themselves. And that's unfortunately where we are in this environment. But I'm very proud of what we've done in putting these billions of dollars back into our community. And I think it's going to make a huge change.
It certainly is a crisis that has so deeply affected many Americans and their families. Peter Mougey. Peter, thank you very much for talking to us. We appreciate it.